Hey guys, Dr. Caitlin here, and we've got Finn. So today we're going to talk about, now people are back in school, sports have started, it's competition season, there's tournaments, and with that means a couple of things. First, it means an increase in training volume for the people that are competing or that are playing sports again, and with that sometimes comes basically deterioration of the movement. So in theory, we know that increased practice of a skill leads to mastery in the grand scheme of things. However, if there's any type of movement impairments or movement dysfunction, which is what we address here in physical therapy, then things in the body are going to break down. That's where we start to get those little tweaks, whether it's your neck hurting or suddenly your back gets really tight. We actually saw that recently this weekend at a volleyball tournament that we set up at. So what that tells me is that there's something going on in the body that over time, the number of repetitions just added up, and now the body has begun to have this thing called a lagging indicator, which means that something happened in the body first, and now we have a red siren going off in the body. So for example, we saw a lot of people this weekend that had back pain. So they're, standing up, they're playing volleyball, they have tightness in their low back because now they're playing multiple games, they're playing multiple nights per week, and their body's not used to that. If they have some sort of movement compensation, like for instance, if they're tilted forward or their lower back gets overly engaged when they're doing any kind of jumping activities, it's going to lead to some back pain here. If you're not engaging your core in the appropriate way, if you have weakness around the shoulder girdle and then you have less stability when you're hitting overhead, that's going to lead to pain in your shoulder. So these are a lot of the factors that we consider when clients come in and they start to address any of the symptoms that they're having. So if you have anything that's going on, please be sure to get it checked out before it becomes something that puts you on the bench. So when we're talking about common injuries, let's say for instance someone who performs a sport standing up gets back pain. They've recently increased their repetitions or their training volume, and over time they come in and they're like, man, my back has been getting so tight every time I jump or every time I go for a run. A couple of things that can be contributing to this, or one thing in particular, is if you have tight hip flexors, that means that this bone is connected up to your pelvis. If that's short, that's going to pull your pelvis down into this position. I'm exaggerating here, but if this is the position that we're in, you're constantly engaging your lower back muscles. What we want to do is work on stretching out this hip flexor. So we can do that by going in here. Let me come out of the way over here. We can come over here by getting into a hip flexor stretch, tilting under and coming forward. A lot of people call this the runner's stretch. You can also do it up off the ground in this position, but you're going to feel it through this side of the leg. A great way to make that even stronger is if we tilt under, we shift forward, and now we're going to lean away from that hip, and oh man, do I feel it. So one of the other things that we can do is called a serratus rock back. Now if I get on my hands and knees and I round up as far as I can, I'm pressing through into the floor, my hand is pushing right here with most of the weight in the palm of my hand. I'm going to maintain that pressure as I rock back, keeping my belly pulled up towards my spine so that my back is nice and rounded. And then as I come back, I'm going to feel a nice stretch in my lower back. So that's going to help address both of those factors. So one, the shortened muscle that's pulling my pelvis forward, but it's also going to stretch out the lower part of the back that's been so overly contracted for that amount of time.